Got some low back stuff going on? This might help. By the way, you'll need some help with this. We're starting in a lunge position over the person that we're working on. It's a good idea to have one hand down on the ground in a bit of a fist as a support mechanism and start to palpate in the low back in the space between the top of the hip, the lowest rib, and the spine. So we don't want any contact with those bony prominences. Once you've found that window of space, then start to sink in really gradually here. The video might look like it's paused at the moment, but it's not. It's just that I'm moving really, really slowly, which is one of the key elements to the ways that we practice. So once you've found that window, start to sink in really nice and slowly into what we call the quadratus lumborum, the QL, the low back region there. Based upon what you feel in terms of the feedback underneath your hand, but also the feedback from the person that you're working on. We have to remember that sometimes the low back stuff here can be really sensitive, and so you need to work in accordance with their tolerance for sensation. After holding it for a moment there, a good minute, you can release like I just did and give it a little sweep and then come back in again. If there's a little bit more space, you can come in with one hand over the top of the other, and that can give you a little bit more access to weight. But of course, we're only going to do that if the person that we're working on has said yes, they can receive a little bit more weight. When you're sinking in as well, you don't need to think about moving over the top of the tissue that like we would normally think of with any kind of oil-based massage. For this technique, we're sinking directly down and into the tissue. If the hands do slide a little bit by themselves, okay, but we're not looking to necessarily encourage that any more than what is already happening by itself. Each time you repeat the application of pressure, you can come into the exact same spot, or you can shimmy a few millimeters in each direction. It might be a little closer to the spine, it might be a little closer up to the lowest rib, it might be a little bit closer down to the hip. In any of those directions that you have a little bit more space to work and explore in, okay? And then you apply a new weight, you see how it's received, you check in with the person that you're working on to see if they would like a little bit more, a little bit less, or if you've got what we call Goldilocks pressure. And if that's the case, you stay right there, hold it for about a minute, and then you slowly release and repeat. Oftentimes with this work here in the low back, we are encouraging the exhalation. So it's worth considering when you release, giving plenty of time for them to take a really nice deep cycle of breath, maybe even two. And a good way to measure that, if you're not necessarily feeling their movement of breath, is to yourself take a really nice deep cycle of breath. And that gives everyone plenty of time to reset before you go in for the next application of pressure. On that note too about breath, you're not necessarily accommodating their breathing, so you're not moving in and out based upon their breath, but you are letting their breath push you out. So especially if someone needs to take a nice deep breath in and they really drive that inhalation that pushes your pressure out a little bit, let the breath push you out. And then as the exhalation comes, you sink in and take up the space that the body has given you, but you're not necessarily changing your application of weight. So you're just letting the body push you out and then allow you back in. As the person giving this work as well, one of the things that we really try to do is make this work relatively effortless, especially this particular technique. And we can do that by having our shoulders either right on top of the wrists or a little bit behind the wrists, and arms being straight, and that drives the most efficient transfer of body weight here. Especially for folks who have quite a decent amount of sensation going on in the low back right now as you do this, that sweep not only is a good way to give them, a little bit of a different sensation in between touches, but it's also a great pause for that intensity that they might be experiencing with the pressure applied. Now, of course, the intensity that we experience in that moment, ideally, is an intensity that can be comfortably breathed into, and it doesn't induce any wincing or any holding of breath, or the other way, it doesn't induce any increase in the cycle of your breathing. So if you're receiving right now and you do notice some kind of change in your breathing, for example, your breathing rate gets higher, or you notice that you're holding your breath throughout this because it's a little bit too intense, just request the appropriate change in intensity so that you can have a nice smooth flow of breath that is somewhat normal for you. We search for that particular amount of pressure or that intensity because that's the perfect point at which you get a nice balance of intense sensation and relaxation. Because we're holding the pressure for a prolonged period of time, it also gives you an opportunity to manage that sensation over that long period of time. And it also gives the nervous system enough time to respond with relaxation as opposed to resisting that pressure. In other words, tensing up. And so you avoid adding extra tension to the area by staying longer and finding the right amount of intensity. Now we've been here on this side in pretty much the same spot, only moving minimally each time we repeat for quite a good amount of time now already. And that's the way that I really like to approach situations where people are in active low back pain, because what happens is each time you work with that perfect amount of sensation, that Goldilocks intensity, you're getting up to the edge of comfort, you're staying there, and then the next time you apply a weight, usually that Goldilocks point or that Goldilocks level is a little bit deeper in the tissue. So after this amount of repetition, you usually get allowed in a little bit deeper each time. At this point, I'm going to switch to the other side, but if you're working with someone who's still experiencing a similar amount of sensation to what they were experiencing at the start, then I would recommend staying for a little bit longer on the first side. Once you make it to the second side, go ahead and get yourself set up in that lunge position over their back and position your hand just above the hip, just below the lowest rib, and just to the side of the spine so that we're not pressing on any of those bony prominences. And remember, it's a good idea to start with a soft fist or your other hand on the ground or on some kind of support near you so that you can distribute weight between your hands, especially as you begin this work on the second side, noting that the second side might be of equal intensity to the first or maybe even more. And so we start the second side with the same mindset that we approached the first. We go in gradually, we look for the responses of the tissue and the body to intensity and the verbal feedback of the person for this second side. With those three things combined, we can calibrate now what we're doing to the second side, because oftentimes it is slightly different. So we need to recalibrate each time we approach a different area of the body. Just like the first side as well, as I sink in each time, I'm holding each application of pressure for around about a minute. I'm watching the breath, I'm checking in verbally to see how the pressure is doing, and I'm making the appropriate adjustments to find that Goldilocks pressure again. Then I'm going to stay here for a similar amount of time overall so that each side is getting a similar amount of work. As you sink in here and pause with your pressure applied, and as you stay and repeat that for the next few minutes, I think it is important to note that everyone's low back pain is comprised of slightly different factors based upon your history of injury, based upon the way that you move or the way that you don't move, the way that you hold your body and things like that. And so I think it's important to note that because this is just one of many potential tools that could help you. So I don't want you to think that this is just the one thing that you need to do. For every person who has low back pain, there's likely multiple other things that you could do to help and that you should do to try and find some kind of long-lasting relief. And so now, having said that, this particular technique is one that I find to be relatively universal. So most people who have low back pain are going to get some degree of benefit from this tool. I always say that the degree of benefit that you get from this tool is reflective of the degree to which you needed this particular technique. That means if you get a lot of benefit from it, then there's a high likelihood that at least a good portion of your low back pain has something to do with the QL. If you get a small amount of benefit from it, then there's a high likelihood that you've got other things going on that are contributing more so to your low back pain than the QL stuff, which is just really a signal to keep exploring. Perhaps continue checking out other videos that I have to see if there are other tools that are going to give you more relief. Now that you've been on this side for a couple of minutes, you might find that each time you repeat, there's a little bit more of that sensation of space that's available to you. Hopefully, as a receiver, the intensity is changing and reducing with repetition here. And that might mean that you might decide to add a little bit more weight. If you do that, remember that one hand over the other gives you a little bit more access to that extra weight. And so when you use that tool, just double down on your efforts to pay attention to the responses of the body as you apply that extra bit of weight. Especially if you haven't received this particular technique in this particular way, what you might find as you do this, especially now that you've done it for a little while, you might find this idea or this thought pop up in your mind that says, oh, I haven't done enough. I'm not doing enough stuff. I should be doing more things. And so you start to move around. Sometimes we get in our mind, especially as a result of having maybe experienced some oil-based massages where we glide over the tissue, you might get the sense that, oh, I should be moving around a little bit more. I should be manipulating the tissues a little bit more actively and those types of things. I would recommend resisting that urge, really committing to the long pause and the hold. And then also I would recommend for the person that you're working on to do this work on you for a few minutes as well, so that you get to feel what it's like for that initial intensity of the pressure to then start to gradually dissipate over time the longer you hold that pressure in place. And then with that experience, that experiential learning of it, the idea or the urge to move around is also likely to diminish over time, because now you'll have the experience of, okay, I really understand this whole sinking idea. I really understand that to get the most benefit and to give myself time to relax, I need the pressure to be held still and in one place so that I've got that opportunity. And with that said, we're now going to start to finish up this work on the second side. If you are working with someone who's got a lot of active low back pain and they could use some more time here, please take that time. Otherwise, when you're ready, you can start to sweep it out, finish up, and perhaps return the favor. And while there are typically a lot of factors that might go into the development of low back pain and low back issues, these tools will at least help to take the tip off the iceberg of that sensation, to give you a little bit of relief, and also often give you a few extra degrees of freedom of movement so that you might be able to then access other ways of moving, other tools that might help you find relief based on the causes of your own low back pain.